thank you, first of all, everyone, for being on here, and I'm all set, ready to go. I think I have it all organized here now.
Okay, great. We're glad.
Sorry about the delay.
Oh no, that's fine. That's
Dr.
fine.
Dukes, you look particularly relaxed.
I'm trying. I am trying hard.
Oh,
so
good.
I do want to welcome everyone to the August 19th, 2020 meeting of the Prince George's Forward Task Force. And as you all can hear, our county executive has joined us, and she'll provide us with some remarks in just a few moments. But prior to that, I want everyone to know that the recording is live, and we all can be heard by not just each other as the task force members, but our viewing public. It's also important to know that the recording will be used as our minutes for every meeting that we engage in henceforward. It's been approved and verified by the Office of Law that we actually can use this recording as our official minutes of the task force meeting. And I think it's important for us to know that, because this will go, the recording will go up on the princegeorgesforward.com website, and those who could not join us at the live meeting will be able to view us in what I call living color as we move through the agenda and listen to the recommendations and present them and actually take a vote to move them forward to the county executive. I also want to remind everyone that our email address is pathforward@co.pg.md.us. That's PATHFORWARD@co.pg.md.us. So for our viewing public, if there's an email, any comments or questions that you have, please use that address to email the task force, and we'll respond to you very quickly. And then our landing page where this recording of the meeting will reside is princegeorgesforward.com. And we'll also show that at the end of the meeting for anyone who may have missed it. So today we are joined by our county executive, the Honorable Angela Alsobrooks, who wants to make a few remarks to the task force. And thank you so much for joining us, County Executive Alsobrooks.
Well, good afternoon, everyone, and thank you so much, Dr. Dukes. I am so happy to be able to be with you all today, and just so appreciate the time that you've taken not only to participate in this very important task force, but I'm so grateful for your presence today. I am, as you know, we continue to battle the coronavirus in Prince George's County. It has been particularly difficult for us here. I just heard from Dr. Carter yet again today, who tells me that we are doing actually very well. In spite of the large caseload that we've had over 25,000 positive infections in Prince George's County, and over 761 of our loved ones have died as a result of this virus. We are fighting mightily, really because of the collaboration that we have had, not only with the medical community, but so many of you who have stepped up to help us. And so we're grateful to see that our numbers are heading in the right direction. Dr. Carter assures me our positivity rate is heading in the right direction, assures me as well the infection rate is declining. Tells me that we are in good shape in terms of hospital utilization and availability of beds. So we're really, really hopeful that we'll be able to continue to work to see declines and to stop the spread of the virus in our community. But while we're doing that, and in spite of the impact of COVID-19 in Prince George's, we are still in the process of safely and cautiously reopening with your help. And now is the time that we believe we have a tremendous opportunity to set our sights on the North Star of Prince George's County and to be poised for a strong comeback. This recovery period is an opportunity to reshape Prince George's County to be the best that it can be. And we have a lot of potential opportunities to build upon. And as we thought about how we could best do that, we thought about all of you as we searched to make sure that we had the best minds and subject matter experts available to help us take advantage of all of the opportunities that we knew would become available as a result of what we've experienced. And that's why you are here, selected for your diverse talents and expertise, and also united by our collective belief in Prince George's County, our optimism about the future, and our desire to see Prince George's County emerge from this very trying period stronger than ever. And so I want to thank right now the task force co-chairs for their true excellence in leading this task force over the past few weeks. I apologize for those of you who heard me. I didn't realize we were live. So Dr. Dukes, I apologize for remarking that you looked a little more relaxed now that you have retired, but we are certainly so proud of Dr. Charlene Dukes, the way she led our community college here and who recently retired and who has agreed, even in her retirement, to continue to serve Prince George's County as co-chair of this task force. She's done an excellent job and we want to thank you. I also want to thank Dave Velasquez, who's also a wonderful ally and friend of Prince George's County, whose contributions and work on behalf of Bill Von Haney have been absolutely critical. We want to thank you so much, David, for your contributions. And I just want to also say, I'm not sure whether he's listening in. I wouldn't be surprised if he is, to say that Bill Von Haney, our really good friend who was serving as co-chair and having some medical challenges now, but I tell you what a resilient person Bill Von Haney is. I received a call, it's been a few weeks ago, from Bill Von Haney, and I tell you, he sounds stronger than I am. So we are just really continuing to pray for him and to look forward to his continued involvement as well. And so you all have supplied the guidance that I knew you were capable of, and I'm just really grateful. So thank you so much, Dr. Dukes, and thank you so much, Dave Velasquez, for your leadership. I also want to acknowledge all of the subcommittee chairs and all of your task force members and our administrative staff whose really ensured the success of this entire process. And it depends on your collaboration. And I just want to compliment all of you on the way that you have made this a true team effort. You put in a whole lot of work in a very short period of time. We're mindful of that. You've dedicated yourselves to reimagining what the future looks like for Prince George's County and our residents, and we're really grateful for that. From your commitment to attending scheduled work group meetings to the extra time outside the task force that we know so many of you are spending, dissecting and discussing tomorrow's possibilities. I appreciate the enormous sacrifices that you have made on behalf of our community. And so I thank you, not only from a very personal standpoint, but want to thank you also from Prince George's County. Now, you are supporting high quality, innovative recommendations that we can implement now in real time. And also you've been tasked with giving us a bold set of policy recommendations for the future. I know that to do so, you've had passionate discussions and really gotten deep into the details of policy and government operations. I have lots of friends on this task force, and I know several of you, and I'm sure this is right up your alley. You've had thoughtful and creative exchanges built on a foundation of collaboration and have worked on a path forward. And so now today is a very exciting day. I was very excited to have the chance to join you today because I understand that you've already produced some results and that today's report will include 47 actions for today. And that attests, of course, to the commitment of the task force and government liaisons and resource teams who've been able to work together in a way that really speaks to your synergy and to thinking outside the box, and also our capacity to lean in with a goal in mind. And that goal has only been to make sure that Prince George's County is better and stronger. So I'm very excited to hear all about the 47 action items that will be presented today. And I'm also eager to hear your ideas on how we can reimagine how our government operates and how we can potentially re-engineer and streamline our existing services to benefit our residents. And as you make the decision today, I know this is a part of this meeting to advance this first round of recommendations to my desk. I look forward to reviewing them closely and considering how they may complement my administration's focus on our key recovery focus areas of education, the economy, health, human and social services, and government operations. And so I am really excited to hear those recommendations. I know they will be forthcoming. And then I know that the next recommendations should and must also chart our future regarding health, education, human and social services, economic recovery and development, as well as government operations and service to Prince Georgians. That includes two different areas. One would be the visions for tomorrow that can be implemented this first fiscal year. And I know that you will be bringing forward also a second set of ideas for a redefined future that could be implemented in the years to come. And I want to be clear about one thing, and that is that we have brought you together because of your thought leadership. I don't want you to be constrained in any shape, form, or fashion by finances. I don't want this to be at the forefront of your decision making. Your task is to bring forth innovative and transformative recommendations. And my job will be to worry about how to prioritize the budget to make sure that we can incorporate them. So in other words, I want you to go wild in terms of really being innovative and thoughtful and bringing us your best ideas and not being constrained at all about how much they cost and what the burden will be. Let me worry about that. And you please just put your thoughts into how to place value on quality and affordable healthcare. I want you to think about world-class education systems from pre-K through higher education. I want you to spend your time considering safety nets and the role of nonprofits for our residents as they access human and social services. I want you to think about our economic recovery and economic development, the needs of small, medium, and large businesses, and the ways that we can attract more of them to Prince George's County, as well as how do we provide training and employment opportunities. And finally, how do we reimagine government operations and how we can better serve residents in our new normal. So we continue to fight through this period for our this pandemic has hit us hard, and we've experienced this as a hardship together in different ways. Some of us have lost loved ones. Some of us are struggling to put food on the table in our county. Others are struggling with mental health issues and from the stress that the pandemic has brought. But it has also created for us an opportunity for improvement and innovation. And it's absolutely critical that we take advantage of this opportunity. We cannot let this moment pass us without asking ourselves the tough questions about how will we be left better when the pandemic is done. That's the opportunity we have, is how will it make us stronger? I've been saying all along that I think there are many lessons and blessings involved in this pandemic, and it is our job together not to consider the lessons that we have, but also to realize that there are many blessings that have become a part of this as well. So this is a chance for our county to break from its familiar boxes and reimagine more ways and better ways of doing things. The road ahead, I know, is tough, but I have to tell you that this team, combined with the team that we've already put together, is truly up for the challenge. Our county is moving toward a new chapter, and I could not be more excited about the days to come. So I just want to thank you again for all of your efforts. I want to thank you for your time, for your commitment and dedication. I am truly, truly grateful for your thoughtfulness and for your leadership. And I have to tell you, I'm quite excited to hear the recommendations that you will bring forward. So again, to your chairs, I want to thank you again, to Dr. Dukes, David Velasquez. I want to thank you all for your leadership, to all the subcommittee chairs, to our administrative staff and everyone. Just thank you so much for undertaking this effort. And I'm excited to see how far it takes us. So I'll hand it back to you, Dr. Dukes, and thank you all so much again.
Thank you, County Executive also Brooks. And we know that you'll be with us for a period of time, and we want to get right into the agenda. But before I turn it over to my co-chair, Dave Velasquez, I'd like to have 2 points to share with the group today. And I would call it personal privilege. One is that you mentioned that I was looking particularly relaxed, and I will tell you the reason why. On the call today, because she has already joined the education subcommittee, is Dr. Felicia Williams, the 9th president of Prince George's Community College. So if you all have the opportunity, please welcome her. So, and thank you, Dr. Williams, for already your tenacity and your service to Prince George's County. The second is a little more somber. Today, we were to have a presentation from Ernst & Young, EY, and they were going to talk with us about the innovative and transformative work that's going on across the country and the very areas that comprise our subcommittees. They are not here today because a key member of their team passed away over the weekend. And we wanted to assure them that we wanted them to grieve and mourn as an EY family, and that we would reschedule the meeting. So please keep them in your prayers, and others who are just suffering in so many ways, not just from COVID, but in so many other ways throughout our community. And with that, what I'd like to do now is thank you for giving me the opportunity to do those two things, and then turn it over to Dave Velasquez, who is going to lead us through the next portion of our agenda.
Dr. Dukes, thank you. County Executive also Brooks, thank you as well. I think you did it, laying out the charge that you have for us in the way you did. I think it really gives us a clear vision of what we need to do. I will say that it's not often as part of a group you get told to go wild, but I will say with the expertise, the diversity of perspectives and the talent, I don't think we'll disappoint you. I think this group will definitely be able to stretch the boundaries, and as you have said, come up with ideas of ways to reimagine and make Prince George's County even stronger. And I can't start anything without thanking subcommittee chairs and all the task force members for all the work that they have done and also continue to do. And as you pointed out, lots of hours, lots of dedication to people that are already busy. So thanks to everyone on this call and everybody who couldn't make it as part of the task force for all your work and all your input into this. Like you, very, very excited to hear the reports and all the great work that's been done already. So without further comments, why don't we turn to get the reports from each of the subcommittee chairs. And we're going to start with Ms. Rosie Allen Herring, who chairs the Human and Social Services Recovery Task Force. And I think the slides are up on the screen. And Rosie, if you want to walk us through.
Sure. Thank you so much, Madam Chair, as well as Mr. Chairman, and certainly to our County Executive, also Brooks. Thank you for this opportunity to be able to share with everyone today. I bring you greetings from the Human and Social Services Recovery Work Group, along with Dr. Askew, as well as the capable team from the county that's working with us to bring these recommendations forward. We have a diverse group of individuals who serve on this committee, who represent all of the sectors, from the nonprofit sector, of course, to the funding sector, to public-private partnerships, as well as the faith-based community. And it also consists of several county professionals as well. We are separated our work for today in terms of the actions for today, or formerly known as quick hits, into 4 key areas that we call our specific focus areas. They are integrating data for the individualized recovery and resilience. It's looking at data because data drives many of the recommendations that are coming forth, as well as we believe it is evidence-based, so that we know that we're having the impact that we seek to have in the community. We're also looking at strengthening public-private partnerships, as well as building the nonprofit and faith-based capacity. We have several very well-meaning nonprofits in the community, and certainly we have a huge and very strong faith-based community in the county, and we want to leverage those opportunities to bring them together and to bring that synergy together, because we believe that that's where the collective impact and collective solutions will take place. We want to identify family and individual needs in real time. As we recognize, none of us could have foreseen, nor anyone had a crystal ball to know that not only would we not be in this pandemic, but we would also be at the same time dealing with the social justice issues that we find ourselves in. And even at the onset of the pandemic, no one anticipated it lasting as long as it has. And so as we look at where we are, we know that we have to continuously look for solutions, not only for what we thought we were walking into in March or so, to where we find ourselves today, and certainly where we believe we will go for quite some time. And finally, we want to make certain that there is an equity stake built into everything that we do, recognizing that all solutions are not the best for everyone, and we need to ensure that we're tailoring it to ensure that we have the impact that we seek to have. And as the needs continue to grow, we will as well. The 11 recommendations we have are a place-based response in terms of teamwork. We want to look at identifying the current programs that the county has, as well as many of the organizations in the county. We have looked to strengthen those and by leveraging what's happening and making certain that we understand the impact. We need to create a unified referral process across service providers to ensure that there is not one segment of society that is serving and not doing as well as some other segment of society that's perhaps doing even better, and someone else in the middle potentially left unserved at all. We want to look at our nonprofit and faith-based, creating a directory to ensure that we're leveraging and that there is a common knowledge of who does what, because what we find is there is a disparate knowledge of who's doing what in terms of serving the community. Many of our faith-based leaders, many of them serve on this task force, do phenomenal work in the community, and they're sought out as a trusted source for those types of services, but we want to ensure that we leverage them as well. We can go to the next slide. We recommend a food distribution czar. Again, just speaking to all of the various opportunities that are there that people are doing to serve. And many of them have been around and been serving for a number of years. But if you are serving and it's only getting to a small segment of our population, that may be good, but we want to make certain that if there's an opportunity to serve even more or to leverage it and not double up in certain parts of the county and others left unserved, we believe having that central point of contact to be able to ensure that communication is getting around to everyone, that then we can know that we've covered or collectively covered the community. We want to offer affordable solutions and sustenance. We call it OASIS. And it's basically being able to leverage unsold foods, being able to glean from those, and making certain that many of our local producers have an opportunity to be able to meet the demand that's there, but also be able to serve their families when it comes to being able to get the food to the food deserts. A survey on returning to senior nutrition sites and having many of our Department of Aging as well as Department of Family Services professionals serving with us on this task force, we've been able to ascertain quite a bit of information on where our seniors are. But before we come with a plan of what reentry looks like, we need to determine what the comfort level is in being able to do that. So we believe a survey that will let us know not just a date, but for certain when people may feel comfortable actually taking advantage of any service that we may offer. And the senior living liaison, because we know that the needs of the senior community is very critical and a high priority for us in the county. We also recognize that when it came to COVID, so many of our cases were seen as coming from senior living facilities. We want to ensure that we're able to give them their priority status and be able to respond to their needs as well, and being able to communicate directly to the state what our needs are for them. We can go to the next slide. And I believe this might be our last one. Expansion of the telephone reassurance program. Again, expanding the breadth and depth of volunteers who can participate and help us make certain that we're fighting the effects of isolation. Because when we look at COVID, it's not just the physical that many of our first responders are attending to, but there's a great bit of mental health needs that now have emerged from this. And for many in our communities, isolationism is one of those key areas that we want to ensure that we bring some attention to. A community mask campaign. Again, it sounds somewhat simple. We believe that's why it's a quick hit in terms of just making certain that there is widespread mask distribution for those who may not have them, those who may have been home and not gotten out, but now may feel more comfortable being able to venture out, but may not have ever had a mask. And for those who have them but need to have them replenished, we believe that there is an opportunity to be able to leverage donations in that light as well. And an eviction PSA, that's become a hot topic, not only here in the county, but nationally as well, where there is a bit of confusion around what the various rules and regulations are from the Department of Housing and Community Development to HUD on a federal level. There is some guidance, and we want to ensure that we're sharing that because we find that to be an immediate need. And so for the most part, we can go to the next slide. I think that may have been it for us. But I want to thank Dr. Askew for his partnership, County Executive Officer Brooks, as well as Chief of Staff Joy. I saw that as well. We want to make certain that we thank them for the great work that they've continued to do. And again, we're not looking at this in the total short term, meaning that this is the end all be all. County Executive, we recognize that we're in this for the long haul. And as I share very often when I'm talking with people, this is something that we will be looking at for the next 24 to 36 months in terms of the residual effect. And we want to and continue to be data-driven, evidence-based, but also not thinking about what a new normal will be, not getting back to pre-COVID normal. We're trying to get to a better normal. And that's what we're working towards. And so again, we will continue to look for the synergies with my colleagues with the other work groups, and we will continue to bring not only now these quick hits and these actions for today, but we will be looking for those visions for tomorrow and our next set of recommendations. Again, I thank everyone who's given us their time on this particular part of the work group. I yield back.
Ms. Rosie Allen Herring, thank you so much for that report. I did want to make two comments. One is, I probably should have done at the beginning, County Executive also Brooks, is to thank you and your staff for the collaboration and cooperation and all the work they have put in to help us as a task group to help accomplish what we're doing. Couldn't have done it without the tremendous support we've gotten from your staff. So thank you for allowing them to have the time to work with us.
Well, thank you. They have been very, very grateful as well to have your expertise. So the collaboration has been tremendous. So thank you both very much. Thank you so much for that report too. Thank you so much, Rosie.
Thank you. The second comment I was going to make is I was going to wait till the end of all the subcommittee reports to open it up for comments and questions, only because you'll see as we go through this, there is some overlap or some areas that are very, very closely aligned, and thought that it'd be good to wait till everyone hears all the reports to be able to then come up with comments and questions, because they could get answered a little bit later as we go through. So with that, let me turn it over to Dr. Wright, who's chairing the Health Recovery Work Group. Dr. Wright. You're on mute, sir.
Unmuted. How's that?
Sounds good.
Okay, wonderful. I was just trying to follow directions. Okay. Well, thank you, Chair Velasquez. And before I dive in here, I want to acknowledge the Also Brooks administration, because this is a sector in which the county executive and the CAO and the DCAO had brought us together pre-COVID. And what do I mean by that? There was formed a health systems leadership group that was meeting regularly before COVID. And that activity actually allowed us to come together for this activity in a way that is rather unprecedented, particularly for health systems. Health systems often work in a proprietary environment, and coming together to share information and share experiences is not something that happens on a regular basis. So the fact that there had already been this platform of communications around the 4 or 5 health systems that serve the county, as well as the other components of the health system, including those in the ambulatory space, those in the insurer space, was really, really helpful in bringing us together. So I wanted to acknowledge that, and was rather a unique element of our group that was commented on throughout our time together over the last several weeks. Next slide. So we were tasked with 7, you see them, 7 specific focus areas, and those 7 focus areas really provided a great opportunity for us to dive into a number of areas. And as I march through the 14 quick win recommendations that emerged from our group, you'll notice some themes. The folks in our group have all been very much involved in response to the pandemic, and part of the challenge here was to bring our heads out of response and to look forward. But you will notice that these recommendations revolve around clinical lessons learned in coming through the last 6 months, and that very much inform what we need to be doing going forward. You'll also notice in alignment with the county exec's mandate to go wild, there was not constraint around the challenges of resources, and certainly in supporting the work of the health department. This was a major theme among our that informed our recommendations. How do we support our health apparatus in the county so that we can do the job that we need to do? And then as my colleague Rosie Allen Herring had also laid out, the importance of recognizing the need of addressing inequities and having a theme of addressing inequity as we move into the response to the next pandemic. So here you see, I won't read through the 7 focus areas. You see them here on the screen. Next slide. We made an attempt to do some level of prioritization, but all of these are important. But I'll start with the quick win recommendation that's already been achieved. The health department's hotline has been transformed to an automated call number prompting system, which allows residents to continue to use the published number and receive from that published number information about test sites and hours, test results, something that I can attest to in my own household about getting a test result from the nurse advice phone line, as well as additional information from 211 and 311. So we can put a check in that box as something that has already been achieved, and in fact was already in the works when we got started. Integrating the supply chain. So this is in the domain of lessons learned. We recognize the importance that emergency management needs to really include a highly integrated activity around supplies, and representation in emergency management response around those who are responsible for supply needs to be tightly integrated. And while these activities in many instances were happening in parallel, one of the points of frustration for those of us on the front end was that we weren't always in coordination with regard to understanding where we were in terms of the supply chain. So this is a very important recommendation. Health department assessment. The health department has undergone a number of assessments over the past several years. However, at this point of really important inflection, we thought it was critical that we empower an internal team. Emphasis on internal. We don't need to go out and stand up an external consultant group to come in and assess the health department. But we do think it is critical, coming through what we've learned through COVID, to assess where we are from a strategic infrastructure standpoint, and strategic infrastructure which is very much rooted in the resource availability for the health department to be responsive, to be nimble, and not be beholden to the large portion of its funding stream that comes from predetermined grants that flow from the state, from the federal government through the state to the health department. And to that end, the group felt very strongly about making sure that realization, that acknowledgement around the funding gap for the health department, that's so much of our resources, 80% in fact, are tied up in grants that are directed towards programs, and that the ability to be nimble and to be responsive to something like a pandemic is hampered by the fact that there is not a robust funding stream from the general funds to support health department activities. Next slide, please. Uniform data contract provision, and this applies for all contracts countywide. There's strong emphasis on making sure that we know where our contracted dollars are being spent, to who is being served, particularly around diversity and equity. And again, this infrastructure is in place as we understand it. And we would just like to emphasize the importance of not only knowing who is performing contracted work, but who is being served by this contracted work from the standpoint of diversity, inclusion, and equity. Next one is the negotiated indirect cost rate agreement also has application across the county, not just confined to the health sector. Currently, we do not have a negotiated indirect cost reimbursement agreement in place such that the overhead costs of grants that the county is enacting is covered. And this is a very fundamental, sort of a very basic component of doing grant related work, that the entity that is carrying out the grant does have in the grant budget an indirect cost rate as part of that budget. And this is something that we believe is critically important to support, again, support the health department in the work that it needs to do. PPE inventory match, speaking again to clinical lessons learned, making sure that we have in real time, minute to minute knowledge of what the status of our PPE inventory is. We have just come through a very much of a roller coaster part of the pandemic for many of the health systems, and understanding where the county stockpile is relative to PPE and helping to streamline the access to that PPE is something that we believe is critically important. Next slide. SMX test messaging, again, a technology that is already in use. I know that the county exec has reached out, because I've received the messages myself, using this technology to communicate mass communications to county residents. And we believe that widespread use of this platform for urgent or other important healthcare mass communication is something that is a keeper and we must leverage moving forward. MOU for quarantine facility. I think it goes without saying that with the number of individuals in our county who have been affected by the coronavirus, that the need for quarantine and frankly post-acute recovery does mandate that we have facilities where this can take place. And having an established relationship with hotel facilities through the establishment of MOU is a critically important component of being prepared for the next phase or response to the next epidemic or pandemic. Dissemination of list of resources. This again speaks to the ability to understand where our surge capacity is. Emergency management here in the county was responsible for the deployment of a large number of resources that included tents and pods and trailers all across the county. I look out my window right here and we have tents and pods right on our campus here in Cheverly. And ensuring that there is coordination again and dissemination of where these resources are, how they're being utilized, is something that's critically important to everybody who participates in this kind of response. Countywide debriefing, speaking again to lessons learned. I spoke about the huge advantage that we have in the county, and that the executive branch had already brought the health systems together. But we also think it's important for everybody who is participating along the entire continuum to be a part of all of the lessons learned in the response to the initial phases of the COVID-19. We obviously are sitting here in late summer with the knowledge that we are about to enter into a unique phase with the flu season upon us, and many valuable lessons learned and information to be shared across all stakeholders is an important element. And then our last slide speaks to the what has already been addressed by the Health and Human Services group. critical moment of inflection here, the intersection of the pandemic, along with the broad recognition of the impact of inequity in our community, such that we think it's critical to make sure that all of our employees at onboarding have anti-racist training, and that this is a recurring emphasis for all of our governmental agencies. This one goes without saying, but we wanted to make sure to say it out loud and include in the recommendations that we move forward to the county executive. The financial model. I've already talked about the challenges of ensuring that the health department is appropriately resourced in order to do its work. We also need to make sure that the financial model to support uninsured and underinsured individuals for access to healthcare is also appropriately sustained. And we do want to call this out as a very, very specific need for the most vulnerable among us. And then lastly, one of the very positive outcomes of responding to the pandemic has been the advent of telemedicine, telehealth. All of us have, as was stated at the outset, have communicated across a number of platforms. Those of us here in the hospital setting have utilized tablets and ways to connect families with loved ones in the inpatient setting using the technology, and certainly providers have really expanded the use of telehealth in terms of continuing ongoing care, non-COVID care, while maintaining social distancing and adherence to the guidelines that have been laid out to protect us. So we want to emphasize that. So I will, at this point, yield back. I know that that was a lot. Before I do so, however, I do want to, again, this is another area that the DCAO for Health and Human Services and Education, Dr. Askew, had his fingers on, and I want to acknowledge his great participation, along with Linda Turner from the county, and Ryan Milton from the health department, who were my right and left hand in moving through the logistics of bringing our group together, as well as acknowledge all of our subcommittee members. So I will stop there and be happy to answer questions during the question and answer period.
Dr. Wright, thank you, and thanks for your group. That's a nice broad range of recommendations and areas that you look into. Very, very helpful. As I said, we'll hold questions and comments to the very end. And with that, let me turn it over to Mr. Graham, who chaired the Economic Recovery Work Group. Mr. Graham.
Thank you. And first of all, good afternoon, County Executive, our co-chairs, and my fellow chairs on work groups. First, I'd like to also recognize my team. Their team members have been tremendous through this entire process. I appreciate the support the DCAO, Rogers, and the entire economic development cluster has provided. And then, of course, Brandon Starks, who has been a tremendous asset to supporting our group. Dr. Wright, I can match your 7 areas with my 7 areas. So they are job recovery, workforce development, business recovery, tourism recovery, economic relief, real estate recovery, policy tools and resources, and then finally, mass transit guidance. To get you grounded on our team, we have about 22 members on the team. I'd like to recognize 3 new members of our team, Councilmember Mel Franklin from the Prince George's County Council, Rick Edson from the Housing Capital Advisors Group, and Dr. Wayne Frederick from Howard University, the president of Howard University. We've split up into 2 groups. One group is job wealth creation under the leadership of David Harrington and also Kerry Watson. And then our second group is real estate and mass transit under the leadership of Jair Lynch and Corey Neal. Over the last few weeks, we've had several presentations to get ourselves a better understanding and a foundation for our recommendations. So those groups have included the Economic Development Corporation with their consultant, Employer Prince George's, the Office of Central Services, Park and Planning, DPI, and then our next meeting will be, our presentation will be with the Experience Prince George's. Our 5 prioritized quick wins are shovel-ready projects. We want to advance projects that are fully funded to get them operational as quickly as possible, which means prioritizing the permit process, marketing economic. We want to be able to market the economic vibrancy of Prince George's County by noting the number of projects that are in the pipeline, and then we continue to move forward. We want to really demonstrate that Prince George's County is open for business. And the projects that fall into this category are those that are ready for construction by the 4th quarter of this year. We want to be able to generate materials and aggregate key economic metrics. And I think as our work goes on, what you'll see is some additional diving into other areas of this whole kind of permit process, shovel-ready process. And I'll get into that a little bit later. Technical assistance. That's our second area. We want to provide small and minority businesses reopening resources. The experience that we're having from of our various team members is people just don't know where to go to get the information in order to take advantage of the resources that are already available. So we want to be able to provide that. That's our recommendation. We also want to be able to provide technical expertise and also take advantage of these resources. An issue that came up in our meeting yesterday, and I think, as business people, we've heard it before, is access to capital. In order for these businesses to be successful, there has to be a way for them to access capital, continue operations, and to grow. How do you execute something like this? Well, I think those are in place already to some degree. You can use existing entities like the Chamber of Commerce as an example of a central depository for where people can go to get information. But there are other business entities that we have in the county as well that could also serve in this capacity. Next, I want to go to the Green Book. We had a great presentation from Jonathan Butler on what he's doing with regards to the Green Book, which is serving as a guide for county-based small businesses and county-based minority business enterprises to connect with millions of dollars in procurement opportunities within the Prince George's County government. County executive, I can't tell you how many times over the years that I've had conversations with business people in Prince George's County who've talked about their lifelong residents. They have businesses here, but they have not been able to do any business with Prince George's County government. And I think you heard that when we were doing some of those business advisory group meetings a couple of years ago. But the other side of that is they're also acknowledged that they have not registered as a diverse supplier in the county. So, as much as it troubled me to hear that they have not been able to do business, I think there's also a responsibility on their part to register. So that is one of the pieces that's important to us to market this Green Book, to encourage people to register in order to take advantage of those opportunities that are going to be available. So it's going to be in a digital format that will match capabilities with government opportunities, which I think will be helpful. And again, we want to be able to support the registration of local small businesses so they can take advantage of the opportunities that are available. Next, mass transit. We want to be able to increase bus service for high-speed need areas to support mobility for essential workers and county residents. As we begin to reopen, a vibrant, effective bus system is going to be important in order for everyone to get to work and get to the places they need to. The transit must be aligned with the regional activity centers in order to be most effective. And then last, by PGC, It's an existing initiative within the Economic Development Corporation. It's providing online listing of businesses in Prince George's County that are currently open, with a special emphasis towards retailers and restaurants. And that's one of our biggest concerns. We've talked about kind of the shovel-ready projects, but that group of residents and business people in that hospitality industry and the restaurant industry are really the ones that we need to find a way to get them back to work. So it's a platform that needs to be updated to incorporate social media and app technology in order to maximize data analytics to measure effectiveness. Right now it's their website. I think there's some opportunities to do a little bit better with that. Certainly as an older person, maybe a website would be effective, but the people that we're trying to reach are using technology in different ways, certainly, than when I was coming up. So those are our 5 quick wins. In prioritize order, our next steps are to await feedback on the quick wins. The one that I think we need the fastest decision on would probably be the green book, because that is something that the county is very shortly, I believe they're going to launch, and we want to be in step with that. We're going to be working on, we've already started working on short-term recommendations. And I think what you'll see are some of those recommendations short-term will feed into what we've already identified as quick wins. So an example of that might be in the shovel-ready area. Permitting process and fee structures could be an extension of that shovel-ready recommendation. So there's still a lot of work to be done, but I think we've made a lot of progress to date. So with that, I conclude my report. Thank you.
Graham, thank you. And also appreciate you identifying kind of like the green book as something to make sure. I know everything here is fairly short term, but to make sure we have that on the radar screen to know that that's something that if we're going to do, we need to do in the short term. So again, thanks to you and your team for all that you've done. Now I want to turn it over to Governor O'Malley, who's been chairing the Government Operations Work Group. Governor.
Thank you, David. Can you hear me? Test 1, 2. We good to go? Okay. I want to thank everybody that's been working so hard on the Government Operations Work Group, my co-chair, Terry Spibner, also Tara Jackson, Deborah Patrick, and no particular order, Sean Stokes, Stanley Early, Wanda Gibson, a really good group, very, very capable people, county executive that you have brought together to make your government work for the people of Prince George's County. First of all, the working assumption that we have been planning for is this, that until such time as there is a vaccine, we have to be prepared for, plan for, and be resilient to the loss of up to 40% of a workforce in any given agency or department or function of government. The second aspect of that is that the best science, insofar as we understand it at this point, says that containing the number of casualties from this pandemic requires that all of us maintain more social distance from one another than we ever have before in our lives and ever before in our work environments. So with that working assumption, with that scenario, and those two realities, the need to be socially distant until such time as a vaccine, and the reality of losing 40% of our workforce suddenly and without a lot of warning, we have had to make a big shift in the orientation of how we traditionally looked at government and local government functions. And that shift in orientation, if you will, in a nutshell, is away from the usual metric of looking at hours spent at work to instead measuring the services provided to citizens. An orientation, in other words, not just a focus on hourly inputs or annual budget inputs, but on functional outputs every day, every week, especially in these times. An orientation, if you will, away from constant focus on time spent on task, and instead to focusing on the connectivity required in order to deliver services. So with that said, we have 4 primary quick win recommendations. Number 1 is remote work. There are aspects of the old way of doing business that simply are a vestige of easier or different times. Let me give you a for example. One of the work policies was that thou shalt not work from home if you have young children at home. Well, that's one of the many policies that Sean Stokes is reviewing in order to give our county workforce a policy that will allow people and managers and the appointing authorities more flexibility in order to get critical tasks accomplished. One of the quick wins that's already come back, it's not on our list, but is a polling document that Sean Stokes put together and put out. A lot of good information there. The overriding conclusion of which was that both the appointing authorities and employees believe they have been as effective, if not more effective, by working from home. So anyway, back to quick win recommendation number 1, revamping our remote work policies to promote public safety while continuing to provide a high level of service. And this will also require training for all employees and managers, certain best practices like a morning huddle and a call at the end of the day, and other tips and trainings of that nature. Secondly, inventory of customer-facing services. That is to say those services, whether they're inspectional services or permitting or providing a service, whether it's a dead tree, broken curb, whatever it might be, to focus on services where the public in the past had to come into a building to interact with government, and making the shift so that those things can be done insofar as possible, as quickly as possible, electronically or telephonically. So that inventory will provide data on services currently performed remotely, services which could be performed remotely, and those which cannot due to some barrier, need to consult paper files, or just the very nature of the work, especially true where public safety agencies, fire, police, ambulance are concerned. Third, digitization of documents with the assistance of our chief of IT. We have been able to look at some initial efforts, scanning efforts, and our intent as a quick win is to focus on the Department of Permitting, Inspections, and Enforcement, the Permit Center, and the Office of Human Resources. Just because it's a pandemic doesn't mean that people won't be retiring or leaving or taking other jobs. So we have to be able to continue to refresh that workforce, hire people, and get the necessary permitting and inspections done, especially to keep people working out there and do the county piece of that, which allows construction projects, home improvement, and other sources of gainful employment to function without the county becoming a log jam in that effort. So the good news is we've identified these as some early quick wins, and there is a bit of a roadmap that Wanda's already been developing with these.
I think we lost.
Am I back? No, I'm back.
You're
Am I back?
Yes.
Okay. Yeah. I love quarantining with a house full of people, all of whom work remote. It makes for a really stressed internet. Fourth and final recommendation is the continuity of operations training and plan development. COOP plans in the past are things that we oftentimes relegate to emergency management. They sit on a shelf, they get dusty. This COOP training and the plan development has to happen in double time right now. And there will be a need to stitch all of those together in a sort of, whole of government view, so that we understand how to backfill from even possibly one department to another department, depending on vacancy rates and the need. And the part of COOP planning is to identify the very most critical services that any department or agency needs to continue to deliver come hell or high water. And right now we're facing a little bit of both. So those are our four quick wins. In summary, the recommendations are all designed, are all with a goal of resulting in necessary improvements to the operations of county government that allow the county to move forward while protecting protecting employee health and resident safety in the midst of the reality of this, unprecedented pandemic of COVID. Thank you.
Governor O'Malley, thank you, and to your task force as well for all the work they've done. And during a time like this, people depend, I think, on county government even more than they normally do. So critically important that they're able to continue operations as well. So thanks for those recommendations. Now we're going to turn it over to Dr. Pines, who chairs the Education Recovery Work Group. Dr. Pines.
Yes, good afternoon, everyone. Good afternoon, County Executive Alsa Brooks. Great to see you, and co-chairs Dukes and Velasquez, and of course, fellow subcommittee chairs and committee members. I've been president now for about 7 weeks of the University of Maryland, which obviously sits in Prince George's County, which we're very proud of. And I have to say that being chair of this education recovery subcommittee has been one of the most invigorating experiences for my 7 weeks and meeting and working with all the subcommittees. So I thank you, co-chairs Dukes and Velasquez, for letting me have the opportunity to serve and present on behalf of my colleagues who also serve in the education subcommittee. Our subcommittee brought experts from industry, academia, and government to really tackle the future and the environment for education. It's just as challenging for education in this COVID world as it is for anything else. And we're moving to a new, better place, I think, for education. So we are leveraging the very strong framework that has been established by the Prince George's County Public School System and the post-secondary educational institutions in the county, and of course, nonprofit organizations and faith-based organizations that help with education, and of course, our private school partners and entities. We are grateful to build upon the foundational work of Dr. Alvin Thornton and the outstanding leadership of Dr. Monica Goldson of our public school system. Finally, I am also grateful to Dr. George Askew from our Department of Health and Ms. Madison Gray and Erica Berry for their assistance and advice to our committee members. It's been intangible. We entertained presentations from Dr. Goldson, Dr. Karen Salmon from our Superintendent of Maryland State Schools, and Dr. Britt Kerwin on the Kerwin Commission reports. Our recommendations are quick wins that are complementary to the work that many have been doing already in the county. We have 5 special focus areas as they're listed on this chart: resetting the pre-K-12 academic plan and delivery models, expansion of online learning and technology supports, rethinking opportunities and delivery models in post-secondary education, resource allocation, and closing the digital divide, optimizing secure technology. So now I'd like to walk you through our 11 quick wins. First one was gap analysis. And this is really an equity issue. So to ensure equity and access to online education, it is particularly important that the gap assessment identify any disparities in access by our county residents, including by race, by financial condition, and those with health and disability challenges. This gap analysis needs to be done comprehensive across the county for us to provide an equitable educational environment for our citizens. For example, we need to leverage the Prince George's County library system as an opportunity for a safe space with high bandwidth Wi-Fi and places for students to learn who don't have access or the environment to do that. That's an equity issue. And we have the resource in the county, which is our library system. So this gap analysis is really important that we think needs to be done. Number 2, expansion of internet connectivity. This goes without saying, all of us need this. The county has been working really strongly in this area, so it's a quick win and very easy win. Sponsoring an agreement with Comcast to provide Comcast internet essentials to families that qualify for that at no charge to those families, especially those who are obviously low income who need the support for internet connectivity. In addition, a second step could be for the families who do not qualify for Comcast internet essentials or live in an area with broadband service. Prince George's County Public Schools System has signed an agreement with Verizon to provide hotspots to our families in need, currently supplying at least 2,500 hotspots, still to be distributed across the county. This is also an equity recommendation as it affects families and their ability to get access to the educational environment and learning outcomes. Number 3, expansion of device distribution in the county. Again, another equity issue. Very important for people obviously to have the appropriate device to connect online and be able to get the learning material. The nature of this is increasing equity and access to the appropriate technologies that are needed at every level. So at the elementary level, the device may be different than it is at middle school, than it is at high school, and then it is at post-secondary institutions. So again, we recommend that this be done on behalf of county citizens. Number 4, digital needs campaign. This is actually really another important partnership that is needed in terms of reaching all population groups, especially those families in the county that are homeless. There's a number of families that are homeless that have young children who require an education. In fact, a study was done that 4% of families in Prince George's County were not reachable by typical communication methods. So we need to find another way through other organizations and through our faith-based organizations, our not-for-profits, and other community organizations to reach these families and close that gap and get them the digital devices and internet connectivity and solutions for their families, even though they may be homeless. That really constituted about 5,000 students in the county. So we're going to move to the next chart, please. Thank you. And so here, this is a great opportunity for the county to aggressively seeking access to education funding, especially under these times where there's been lots of legislation that has been passed as emergency legislation to help support education. And I just want to highlight a few of them. Obviously, through the CARES Act, you can get funding for elementary and secondary school emergency relief funding directly to the county and to the state. There's community college workforce development programs that one could access. There's the U.S. Treasury tutoring grant that one can provide proposals for and get grant money. There's the U.S. Treasury technology grant to get technology for our families in Prince George's County. There's a governor's emergency education relief fund, K-12 funding, that we can write proposals to. So there's lots of opportunities in this critical COVID time, and we must leverage that on behalf of the students and families in Prince George's County. Number 6, teacher resource reallocation. And this is actually a very innovative plan. So this came out of one of our special focus areas, where as we look at our assets, our great teachers, some of our teachers teach well online, some of our teachers teach well in a modality that's in person, and some of our teachers teach well or provide services such as tutoring and advisement, and they're better suited for that. So if each school system and each school looked at a reallocation based on, people have better skills for online, better skills for in person, then we could effectively deliver a high value quality education for the online modality part, for the in-person part, by simpler reallocation of our talent pool and really emphasizing their strengths to deliver the best product to our students. So this is a cool strategy that we've came up with one of our working groups, and we think it will, with not much investment, lead to great outcomes for our students. Number 8, a holistic approach to socio-emotional well-being. There's a lot of folks suffering. I don't think I heard anyone say this, maybe they said in the health group, we have mental health crisis across the board. A lot of folks dealing with complicated situations with their families, access to technology, internet connectivity to get an education. It's quite incredible mental health issues themselves. And so we believe that there's a holistic approach here, leveraging both the educational resources from Prince George's County Public School System, but also faith-based entities, not-for-profits, post-secondary institutions to help with mental health services and other services that are holistic for the family to ensure that their health and safety and well-being is taken care of while they're trying to obtain an education. And these needs to be done comprehensively across the county. Next one, teacher preparedness partnerships. So fortunately, this committee has revealed a number of partnerships between K-12 and post-secondary. So we in higher education, like where I'm at, we have the ability to contribute to the county in many different ways. For example, we can help train teachers in the online modality. We've been doing that for our faculty for ages. That's a simple partnership between our community colleges, our four-year institutions like mine to easily partner with the county and provide almost at no cost services to our broad K-12 teacher population so that they can be more equipped to use the technology and deliver high quality education to our students. We think that's a really great partnership. Next chart, please. Addressing crisis with deliberate dialogue. This is addressing the issues of social injustice. We, and again, the post-secondary educational institutions in the county, at Bowie State, at Prince George's Community College, at the University of Maryland, at other institutions, we have great thought leaders who can do these anti-racism training. They can do the hate bias training. They can go into K-12 and provide those services literally as seminar speakers or as invited speakers at no cost to our educational enterprise and help advance our ability to be a more culturally inclusive and respectful environment to allow all students to reach their potential. We think this is an easy, quick win. Collaborations are already happening from post-secondary institutions to K-12. So we think this is really great for our students to have these kind of deliberate dialogues and interface with experts that are in our county anyway. So that's number 9. Number 10, expanding the dual enrollment program. So we already have, again, these great partnerships between K-12 and the Prince George's County public school system and Bowie State and Prince George's Community College. So there are pathways of access and affordability that allow students to take a course in high school, and we can expand this program so many more students can get access and get credit both in high school and in college and universities. So that provides a seamless pathway to get a 4-year education or a 2-year education at our partner schools in the county. And then finally, we believe that there should be a 24-hour, 7-day-a-week access to the online material. There's no reason that if we deliver or develop this asynchronous learning online material that it's not available to any student at any time of the day, every day per week, including the weekends. So building up the infrastructure and the database systems to have that, the internet capability that provides access, and the device tools that allow our students to be able to access that information to enhance their ability to learn at any time of the hour, any time of the day, any day of the week going forward. So those were our 11 recommendations. We're super excited about where we are and where we're headed. And I thank you for the opportunity to present today.
Dr. Pines, thank you. And thanks again to your subcommittee and all the work that they've done in such an important area as education for all of us. This concludes the presentation of quick wins from each of the 5 different subcommittees. As I said earlier, wanted to open it up to anybody from the task force, anybody who has questions or comments they would like to offer. Now is the time that you can do that. And the subcommittee chairs are here to be able to answer or respond to any of those as well.
I don't have a question yet, but I want to certainly just say thank you so much to all of our subcommittee chairs and the members of those committees. You've done an amazing job. I'm already excited about the recommendations that you've made and look forward to digging more deeply into them. But they obviously reflect the thought that's been put into them and set out for us. You all have a lot of work cut out for us, which we're excited about. But I do want to thank you for your thoughtfulness, and I look forward to getting them. I understand from David Sloan, he told me not to worry, that there's even more detail, I believe, that goes with them, and I'll look forward to receiving the complete portion of those recommendations. So thank you so much, everybody.
So, Dave, I'm not sure if I see any hands or questions. I don't know, Linda Turner might be monitoring that for us.
I don't see anything on the chat.
Madam Chair, is a motion in order to fully move these recommendations to the county executive for her approval?
Yes, it is.
Then I move that we accept all of the recommendations from each of the subcommittees of the task force to go forward to the county executive for her consideration.
Thank you. Do I have a second?
I second. Darrell Pines.
Thank you, Dr. Pines, for a second. Because there's so many folks here, not going to go through asking everybody to say aye, but rather any objections from anyone? If not, consider the motion passed, and we will move forward in forwarding these recommendations to County Executive Alsop Brooks. And again, let me thank all of you for the tremendous work you've done, the breadth, the creativity, the perspectives you've brought to this wide range that I know will be of assistance to the county and to the county executive as they work to not only the current crisis, but also reimagine and have us come out as a county even stronger at the end. And I'm going to turn it back to Dr. Dukes to talk about the schedule because, as you know, our work is not done yet, but rather we have a couple more phases we need to work on and provide recommendations for. So with that, again, thank you, and I'll turn it over to Dr. Dukes.
And certainly, Madam County Executive, before you have to leave, because we know that you do, there is always work to be done. We want to thank you for our new slogan, Go Wild. That's exactly what we're going to remind everyone to do as we work over the next coming months. But so thank you for joining us today. Absolutely.
Well, thank you all. Thank you so much. And thank you again to our co-chairs and to all the members. Thank you so much. And yes, go wild, everybody. Go wild. This is our moment. We've been waiting for an opportunity like this one. So thank you all so much.
Take care. I know that I think we have a slide that's going to come up on the screen, David. We have a revised schedule. I will say that over the course of the last week or two, I've had the opportunity to meet with each of the subcommittee chairs, and thank you for your work, and thank you for really what were some enlightening and telephone calls and thoughtful dialogue and discussion. And one of the things that came up is that there's a lot going on at this time of the year. We all know that schools and colleges are opening, businesses are opening a little more every day. And because we were so focused on the what we call the quick wins in real time, we wanted to revise the schedule just a tad in order to allow you all to breathe for 48 hours, and then we would continue our work. So we do want you to know that, and David, I can't see the entire screen, but that our sort of short-term wins, what we want to do with those recommendations is to ensure that they are submitted not in September as was originally scheduled, but by October 14th of 2020. Dave Velasquez and I will have the opportunity to continue talking to the subcommittee chairs, but wanted to let you know that we recognize that each one of you leaned all the way in over the course of these last several months. And while we will lean in even more, we'll give you a little bit of breathing room to do that. So just understand that the short-term recommendations should be submitted by October 14th and not in September as was originally scheduled. We're also going to be looking at the calendar as we think about November and December and make sure that we're giving you the opportunity to dream and to go wild and think about what we aspire for our county to be and how this work around these 5 work groups can add to that vision. So I think if there are no questions, we'll just keep moving. And I can't imagine that anyone would question being given a little more time. So what we have next is a brief communications report that'll be presented by David Sloan and Molly Byron. Wanted to let you know how we're communicating the work of the task force to the general public. So David and Molly, I'll turn it over to you all.
So our partner in progress, Molly Byron, is, she is on baby duty. We knew that she'd have a flexible schedule, so I'm just going to go ahead and take the entire report, which is very, very brief. Personally, I do want to say on behalf of our whole staff team that we really have enjoyed working with every single member of the task force. It has really been an exercise that has enriched our intellectual capacity, and we are seeing a lot of progress. Conversation, we realize that we've asked everyone to work quickly, but I think that we're getting so much out of our interaction with you all, and that's because everyone is sincerely involved in the work. And so that's important to say because it sets up the imperative that we've got to communicate this work to the public aggressively and repetitively and quickly. One of the goals that we always keep top of mind is that policymaking is the first half of progress, but also communicating it to the public is the second half of it. Making the public aware of the resources you're making available to them is as important as framing and developing the policy. So we've already started some laying of groundwork with the local press corps. Dr. Dukes and Dave Velasquez sat down with reporters from across the region and the country, by the way, and kind of set the stage for what they would expect in terms of the rounds and the categories of recommendations. And now that these recommendations are dropping, we're going to engage, the media again. That's just one leg of the stool. We want to make sure that we're continuing to keep our communication strategy rooted in the mission, which is one, you all are crafting high quality recommendations that we can implement in real time. So we check that box. And now you're moving to help us reimagine the future, and we'll check that box. And so the challenge for us is to begin to kind of orient the public in Prince George's County to what these recommendations are and which ones are adopted and how the rollout is going, especially recommendations that we know have a direct kind of impact on communities and neighborhoods and constituencies that have been waiting for this progress to happen. And so our whole communications team is thinking about all the different modes of which to engage the public and the press so that your work gets elevated to the proper level that it needs to be, so people understand what we are doing beyond just broadcasting our meetings here. So just to put that in context, everyone knows that a task force has to release a final report. Well, we're not releasing a final report. We're releasing a report in three different phases. So once the process of finalizing the quick wins is over, we will release the first edition of our public report sometime in September, which will chronicle the work that you've already done and this first round of recommendations that have been adopted. We will then release the second two rounds of recommendations as they are worked on, put forward, and approved. So our final report will actually be released in phases, with the final report coming out later this year, towards the end of the year or early next year. But along the way, we want to make sure that as recommendations have been confirmed, that we are engaging traditional print and radio. We're explaining what recommendations are on our digital and social platforms. We're going to produce a series of explainer videos, and I'll get into that in a second. We're going to do some paid video for sure, and we're going to exhaust all our internal county executive assets, our newsletters, our town halls, our social media, and other in-house assets. So here's where you come in. So we have a small army of individuals that make up our task force. You all have platforms, many of which you might be able to use to promote the work that you're doing. So we're going to arm you with, pre-written posts, for Facebook, Twitter, et cetera, that you can use on your own time to promote the work that's going on in your individual committees. We're going to try and utilize the subcommittee chairs and members where we believe there's a potential to, film an instructive video that explains a key recommendation that has real life impact in real time. One of the examples is, how we're changing our dynamic when it comes to remote work, or even how we're redesigning layouts within buildings. There was what we had before and what we have now. The idea is maybe Dr. Dukes and Governor O'Malley walk and talk to a video explaining what we've done. But there are going to be several different conception meetings where we think about the videos that we should design and then release, in kind of paid social media buys. But that means we're going to be working with you all to make sure we're utilizing, your reach and your access to others. We want to do all we can to promote the new landing page, princegeorgesforward.com. It is really important that everyone start to promote that website. It's going to be the clearinghouse for all this information. And as the public reports are done, as we have more and more video kind of catalog, it's all going to go there. And we're going to connect it to, other places that we need to make sure we're making the connection between, interagency policy decisions, recommendations. For example, we know that PGCPS is aggressively communicating to the public. So we want our forward task force to promote what they are doing in real time. And we're going to make sure that we're making all of the points of connection that we need to make. And finally, as we have these conversations more and more about communications, ideas, and tactics, we ask for your help and guidance and input. All the members of our team have made it really clear that we want this to be collaborative. And when we're talking about not only crafting the recommendations, you all should be thinking about how best to reach the constituents of the county, especially those that you interact with on a regular basis. What works, what doesn't, what should we be doing for sure, what should we stay away from? So with that, ma'am, I yield back to you.
And I should ask, are there any questions with regard to David's briefing around communications? We just want to make sure that we're using every medium and every platform possible to inform not just Prince George's County, but I can assure you that the region is looking at us as well. Dave and I had a great conversation with the media several weeks ago, and we know that that was probably just the beginning. So any suggestions or ideas that you have, please move those through your committee chairs, and then they will make sure that they get to Dave and myself, and then to the support team that's surrounding all of us in this work. We are prone to give you back a few more moments of your time. Want to thank you for being with us today, the full task force. And I know that we've said it time and time again, but it is your work that will support who we are and who we will be as a new and better Prince George's County post-COVID. I will say to you all that as I have been moving through the screens, it's great to see so many of you, and to know that you and your families, we hope, are doing well. I would end by saying for our viewing audience, again, if you have any questions or comments that you want to send to us, please do it through our email address, which is pathforward@co.pg.md.us. And for those who will want to share that this recording will be on our website, please, it will be on princegeorgesforward.com. Thank you all so much, everyone.
Madam
Yes.
Chair,
I think we have Mr. Graham.
just
Oh,
a
thank you.
question. It's actually for David. David, are you going to provide the exact language to be used for the web, for
Yes.
social media?
Yes.
Okay. All right. That's all I have. Thank you.
Thank you for that. And with that, everyone, please enjoy the rest of your day and your week, and we'll see you soon. Take care.
Bye-bye.
Thank you.